Hello, I'm journalist Pennie Taylor, and on behalf of the Health and Social Care Alliance Scotland, it's my very great pleasure to introduce Derek Feeley, Chairman of the Independent Review of Adult Social Care. Welcome to you, Derek. Now, the review group recently presented its vision for transformation of the sector in Scotland. Ambitious and achieved at breakneck speed in very few short months, it's actually a good read and certainly reflects the views of very many of the people I know who work in social care and those who use its services. It's been generally well received since it was published, and now there's been a time for closer reading. Of course, there are lots of questions. The Alliance invited its networks to put their questions to Derek. There were lots, so we've themed them, and it falls to me to ask them on behalf of Alliance members. So, Derek Feeley, in the run-up to your review, there was lots of discussion about full-scale nationalisation of the care sector in Scotland. You've gone for a national care service, but following a different model. Can you tell us how you see that working?
Sure, Penny, and it's great to be back with you. We started our work on the independent review, you and I talking together, and so it's nice to come full circle. The first thing I would want to say in response to that question, Penny, is I understand why a lot of the attention about the report has been on this idea of a national care service, but actually there's much more in the report than that. And I think it's always important that we keep our recommendations about a national care service in the context of the remainder of the report. We'll only get the improvement in the outcomes that we seek for people if we, in our view, at least do everything that's in the report. So change the narrative about social care and what it's for, build on our foundations and close the implementation gap between what was intended and what's experienced for people, and create a national care service. And so the first thing I would want to say is it's really important to keep those things together as best we can. I understand the focus on the national care service. It's quite a radical proposal, but it's not the entirety of the report. You're right that we didn't go as far as to say that the whole of social care in Scotland ought to be brought into national ownership. There were a few reasons why we did that, Penny. Firstly, the way in which our terms of reference were framed were about recommending improvements in terms of the outcomes achieved by people. And so the first set of questions we asked ourselves was, is it the case that people receiving social care support get better outcomes if they get that from the public sector? So we interrogated the Care Inspectorate's repository of inspections and reports. If you look at care at home, actually probably the third sector do marginally better. If you look at care homes, and again we looked at the report that Public Health Scotland had done about the impact of the pandemic on care homes, larger care homes were the problem. By and large, that was the biggest indicator of whether there was a challenge in that care home about safety and quality or not. And so that we couldn't muster a very strong quality argument for bringing ownership back into the public sector. Then we looked at just the practicality and the costs. So there's 1,000 care homes for older adults or for adults in Scotland. If you think that it costs something like £900,000 to buy back a relatively small care home in the Western Isles, you can only imagine the amount of public money it would take to bring back into public ownership those 1,000 care homes. And so then you're down to choices. You can only spend the money once. And we thought it was better to spend the money on extending the range of people who could get adult care support and investing in prevention and early intervention, and putting money in the wage packets of the workers, in reopening the Independent Living Fund. And so that was our sense of the real priorities, Penny. And so some combination of those things led us to the conclusion that we could create a national care service without necessarily nationalising the whole thing.
Now we're going to come back to the issue of money, because there's a few questions about that, as you can imagine. But the report recognises the good policy that's in place, even the good legislation that's been put in place in Scotland, for instance, around self-directed support. However, there has historically been a real gap between that intention and the reality. I think you call it the implementation gap. How are you going to overcome that patchy implementation of policy? I mean, up until now, it's been a choice of the providers of care, yeah? Yeah.
So I think that will be one of the priorities for a national care service, is to be, firstly, absolutely clear about what are the national standards that we expect, and to set those out with clarity and with purpose. Secondly, to pay some attention to the variation that exists in our system, and to provide ministers and the Parliament and the public with assurance that we have variation because it's necessary and warranted, because it's to meet individual needs or the needs of specific localities, rather than just being random variation. And then also to sponsor national quality improvement programs, which is something we've never been able to create in the social care sector. We've identified 3 areas where we think those quality improvement programs can really make an immediate impact. The first is in safety and quality in care homes. The second is around self-directed support. So making sure that we get from current state, which according to the work that the Alliance and Self-Directed Support Scotland did, we've probably got about half of the people who could really benefit from self-directed support actually benefiting at the moment. And the third is around the redesign of commissioning and procurement.
Now, some might say that what you are calling for is centralisation, because basically you would be vesting in the Scottish Parliament, in government, the oversight for the whole sector, the responsibility for the whole sector, yeah, taking it away, in fact, from local authorities to that extent. Is that centralisation, or is it necessary structural change?
So one of the things that people said to us loud and clear, Penny, throughout our consultation exercises, one of the things that they wanted was for social care to be given parity with the NHS. And so that putting of social care on an equal footing with the NHS was part of our motivation for recommending a national care service. The second thing was just really an acceptance of reality. And I think the pandemic has magnified this, and that is that people expect Scottish ministers to be accountable for social care. We've seen that throughout the course of the pandemic. Questions, I think quite legitimately and appropriately, have been put to ministers about what are you going to do about this? And so if ministers are going to be held accountable, you need to give them the levers that they need to meet those accountabilities. And so, again, that was what was in our mind as we proposed a national care service, not centralisation itself, but just an expression of the reality of the situation. And then we did want to do something about what people described to us as a postcode lottery. Why was it that I could be eligible for something in one part of the country and I'm not eligible for it in another part of the country, or I get charged for it in one part of the country, I don't get charged for it in another part of the country? Why is it that if I've got a package of support that's agreed for me and I want to move house, I need to start from scratch again? And so there was a set of things that people raised with us that they wanted us to address that we felt were issues that were best addressed at a national level.
You're recommending that the role of the integration joint boards changes. Can you describe how you would like to see them working, and how difficult is that going to be to achieve, I suppose?
Yeah, so the integration joint boards is how we give effect to that local dimension. So they would be the entities that were delegated responsibilities from Scottish ministers, including a budget, and invited to engage with local communities around understanding local needs. Some of them are, I think there was a really good report from Audit Scotland 18 months ago or so now, maybe even a bit more, about where integration joint boards had got to in their maturity. And they recognised, I think, as we saw, some of them, really up and running, fully meeting all of the expectations, and some not quite there yet. And so everybody is going to have to be brought up to the level of the best in terms of that engagement with the local communities, that giving effect to integration of health and social care. People also said to us, we want our voices heard better around the integration joint board table. And so we are recommending, for example, that unpaid carers who currently have a observer status, if you like, on the integration joint boards, become full partners in those boards with voting rights and so forth. We also think it's really important that the integration joint boards begin to bridge the gap between purchaser and provider. So we'd love to hear provider voices around the integration joint board table, and that brings responsibility and accountability to the provider group also, but starts to close the gap between purchaser and provider and get us much more towards collaboration and away from competition. So those are some of the reforms, Penny, that we think integration joint boards need to embrace.
Mm-hmm. Like what's going to be challenging for them?
There's a lot of responsibility on them, and they're going to have to be. They're going to have to be good at translating national intent into local implementation and local need into national strategy. And I think they have a crucial role as the kind of interlocutor between national strategy and local need. The other thing I think they're going to have to do really well is be the home for a different approach to commissioning and procurement that many people asked us for and we're recommending. And they are going to have to give that effect.
I'll come back to that as well, because we've got questions around that. But I was struck reading the report about the call for real involvement of people that use services that are real, change the focus from what suits providers to what suits recipients of any care support they might need. That's going to demand changing that power imbalance is going to demand real involvement, meaningful involvement of people. We've got big changes, surely, that are coming down the track towards us as a result of COVID, among other things. People are going to have to be involved in shaping services that suit them. How can a national care service go about promoting and building that? It's huge culturally.
Yeah, so I think that I think probably needs to be done at a number of levels, Penny, at the individual level and at the collective. So at the individual level, a national care service, through full implementation of self-directed support, could give full expression to that empowerment of the individual. That's really what self-directed support is intended to do. The clue is in the name. And so the more we can make sure that that works as it should, and again, it's one of the reasons why we've recommended that as one of the first improvement priorities for a national care service, the more likely we are to empower people in the way that you would want, and I think they told us they would want. Then at the collective level, it's about hearing the voices of people with lived experience around the right tables, and giving them their place as equal partners. And I think we've been in Scotland rather better historically at the first of those things. I think maybe not even reliably hearing the voices, but at least hearing the voices. It's the second bit. It's the as equal partners that I think demands the change in emphasis and in approach. And that's why I think we need to, I think there are probably 4 bits, Penny, to the kind of empowerment of people with lived experience. There is the bit about hear my voice. The second piece is about honour my rights. So the more we approach this set of issues from a rights-based perspective, the more likely we are to foster the changes that you would envisage. The third, I think, is ease my way, I call it. Just make it easier for me to engage in this system. I was struck in our consultations about how many people said, yeah, I managed to get something eventually, but it was a fight. Well, it ought not to feel that way for people. It ought to be just easier for people to engage with the system. So that's what I mean by ease my way. And then one of the participants in our in the video that we created to accompany the report, I think summed it up beautifully when she said, people with lived experience are not the problem. We're the solution. And that, again, that's part of the shift in our thinking that we envisage in the report. So I think if we could do those 4 things, hear my voice and as a partner, honour my rights, ease my way, and see me as the solution, not the problem, then we've got a chance of getting to where you would want to see us get to.
Now, obviously, as you would expect, not every part of Scottish society is as behind your report. I'm going to take that question again. It's been interesting watching the response of local authority leaders, because if you look at this on paper, they're having a lot of their power taken away from them, is the proposal, and invested, say, in integration joint boards. Critically, one of your recommendations is to separate the roles of local authorities as both providers of care and commissioners of care. Why does that matter?
I think it helps us to make one of the transitions that we want to make, which is away from our historic thinking that what we're trying to do here is manage need towards what we're a future and where we're trying to ensure rights. And Penny, I understand some of the feelings of local government about the report. I think it's also important to note that in the statement that came from COSLA, they did say there were many things in the report that they were supportive of. And so I think that positive reaction to large pieces of the report is just as important, I think, to recognise as the different approach, I think, that many in local government would want us to take to the structures and the processes. I continue to think that there is a very, very important role for local government in social care. A really important role as a provider of social care. A really important role as a partner in the integration joint boards and bringing their understanding of local needs, local populations to the table. One of the new things we recommend in the report is this idea of creating provider alliances and public social partnerships so that we can bring some kind of synergy to the provider community. We can get the best of all worlds from those, and local government are the obvious places to host those provider alliances. So again, a really important role for them there. We envisage in the report alternatives being developed to traditional residential care. Again, a really important role in the future for local government. And we recommend a big investment in earlier intervention. And so, again, I would hope that local government would be front and centre of those innovative approaches to providing earlier intervention and prevention. And so, I can foresee a really, really important role for local government moving forward in partnership with the third sector, for example.
I suppose some of the questions are about, how does this simplify the process? It's already a confusing landscape out there. We've got integration joint boards, ACHPs, local authorities. Is this a danger that we're just creating more bureaucracy?
I don't think so, Penny. So first thing, there's nothing wrong with a little bit of structure, so long as it's in service of something. And I think one of the things that we're trying to clarify in our report is what's the purpose of social care, what's it here for? And so we've got a sense now of whatever structure we create, what's it in service of? It's in service of rights-based social care. It's in service of a collaborative endeavour. So we've got a stronger sense of what's this thing for. Secondly, we're trying to propose a way of streamlining some of what gets in the way currently. So let me use finances as an example of that. So at the moment, it's quite hard actually to say what is our national budget for social care. We'll have one now in the future if this report is implemented. Currently, the integration joint boards, their budgets are determined by a negotiation between the local authority and the health board that often takes to the middle of the financial year to resolve itself. And so the integration joint board is unable to fully meet its commitments because it's uncertain about whether it's got enough money. We'll remove all of that just by directly allocating the monies from the national social care budget directly to the integration joint board. And so that cuts out a lot of that bureaucracy that currently exists about what is the budget. It also, I think, helps us, Penny, with accountability. So it'll be much clearer now about who is accountable for what in terms of stewardship of the resources. So I don't see this as increasing bureaucracy in any sense, and I think there are a number of ways actually where this will make the current system work more smoothly.
How do you think a national care service might facilitate greater integration, say, between primary care, acute care, and the social care workforce, but at the point of delivery, at the point of care?
Yeah, so I think before we get to the point of care, and I will get there, there is, I think, an important potential around having a national care service sitting alongside the National Health Service, as we say in the report, on an equal footing. Because I think it's really important that strategically we plan the future of social care alongside our planning of the future of healthcare. And the more those two things can be done together, the better chance there is of the asks that we make of integration joint boards, of provider organisations being integrated and joined up. We have recommended that the integration joint boards get responsibility for the range of integrated services. That includes primary care. So it makes sense to us, for example, to give the integration joint boards responsibility for managing the GP contract alongside managing the contracts that they'll make with a number of establishments that need primary care support, like care homes, and providing joined up health and social care support to a number of individuals who need both. So there's both a strategic benefit that comes from having a national care service sit alongside a national health service. And it also should help us to make sure that what we ask local entities to do is joined up, and that what people experience is joined up, because we've done that strategic thinking.
And so you see the IJBs being the kind of valve by which that would work. That would be the point at which integration would happen.
Yeah, and as I said earlier, Penny, I think it's two-way. So it's not all just flowing from the top down. I think there's a really important role for the integration boards in gathering local intelligence about what are people's needs, rights, and preferences, and feeding those up to national level, which again is something that we haven't been able to do in the past.
Let me move on and ask a few more questions that have come in from Alliance members. Now, your review was commissioned mid-pandemic, following the turmoil of COVID-19 infections that hit care homes so heavily, following discharge from hospitals often. Did your review get any insight into why so many people died in care homes in Scotland during that first wave, particularly? And which of your group's recommendations might prevent that from happening in the future?
Yeah, so Penny, we did not look at in any great detail at that specific issue about deaths in care homes. It was not part of our terms of reference. There was work that preceded our report that was done by Public Health Scotland that we drew on. And I know there is consideration being given now to some kind of commission or independent study of exactly what went on in care homes at that time. It wasn't central to our terms of reference, and indeed most of the issues that we were invited to look at predated the pandemic. A lot of the thinking that people raised with us, however, was informed by the pandemic. So, and not just at the care home end of the spectrum, I would highlight, for example, the burden that we place on unpaid carers, which has got significantly more intense over the course of the pandemic. And some of the things that we're recommending in our report about the support that unpaid carers need to continue to provide support and also have a life themselves, I think has only intensified in the course of the pandemic. In relation specifically to the care homes, I think, you know, a little bit like how, if we cast our mind back to the tragedy at the Vale of Leven Hospital, it was really a impetus and an inspiration for a big national patient safety program in the health service. But we went about that in a way that wasn't just about tackling those specific issues in the Vale of Leven, but rather in raising all boats and making sure that the whole system is better. And I think that's the right approach to take also around the care homes. I think the national improvement program that we recommend about quality and safety in care homes should pay particular attention to those specifics of the pandemic, but it should also look at any pre-existing harm that people are suffering in care homes. It should also look for good practice in our care homes and seek to scale that up and spread it across the whole country. I'd like to see us take a whole system approach to improving care in care homes. And that way, I think we're much more likely to get the willing participation of the whole care home sector.
Now, your report appears to really have a vision for very many more people continuing to live in their own homes rather than being transferred into care homes. You've pointed out that, you know, it's often a necessary step because there just isn't, there aren't the simple supports in the community available that would prevent that from happening. I mean, clearly, that's a vision for the future that's going to demand a lot more, perhaps, of unpaid carers. who I've been following the response of unpaid carers to the report since it was published. And it's interesting, you came in for a lot of criticism for not giving that enough attention, allegedly, at the start of the process. And a lot of people, feel that sort of calling for more support is perhaps too vague for them. Do you think you've addressed unpaid carers' concerns about where they sit in this whole structure in Scotland right now?
We've certainly tried to, Penny. The community of unpaid carers will give you a better answer to that question than I ever can. But we certainly tried to. We had numerous engagements with various groups. The Coalition of Carers in Scotland was particularly helpful to us in making sure that we reached as many carers as we could. But we also talked to carers representatives on IGBs, etc. The things that came across in our meetings with them that we've tried to address in the report are recognise us, value us for the contribution that we make. And so we've tried to do that by carving out a whole chapter in the report that's just about the needs of unpaid carers. The second set of things that they asked us to do were the same kind of things as we talked about people with lived experience. Hear my voice and honour my rights. And so again, we are making very specific recommendations for how that voice of the unpaid carer should be heard as an equal partner, not just in the Integration Joint Board, but actually in the Board of Governance of the National Care Service. And so it's going to get the unpaid carer voice heard at the right level with the right kind of authority. Third set of things they asked us about was make it easier for me to care. And so that's where some of the support that you highlight in the report comes from. And some of that, if it needs to be, is quite hard-edged. We recognise that the Carers Act currently does not provide a right to respite, and unpaid carers have human rights too. And so one of the recommendations we make is that it ought to be extended to give people a legal right to respite. And so, Penny, we did the very best we could to engage with the community of unpaid carers. We listened to the really important feedback that they gave us, and we've responded to that in the report as best we can.
Now, also by recommending a direction of travel that is about facilitating, enabling more people to live longer in their own settings, at home or close to home. You've acknowledged that, for instance, might alarm some providers in the care home sector. Some people are saying that it will be unprofitable in Scotland and they're in danger of walking away. Do you think that's a risk?
That's a big question, Penny. I guess let me start by saying I think none of us have certainty about exactly what is the right configuration of social care services for the future in Scotland, and we've made our best endeavour to highlight some of the things that we think that are already going on that could, through a national care service, be scaled up nationally. There's one thing I think that pretty much everybody is agreed on, perhaps with just a few exceptions, which is whatever is the answer to the future, it's not more care homes. And so we need to figure out what are the best alternatives. And we heard in the course of our work some fantastic examples of support for people that enabled them to live good lives at home. The Shared Lives programme would be one such example. Some fantastic work we heard from Alzheimer's Scotland around earlier interventions immediately post-diagnosis of dementia, which were really helping people live much longer and better lives in their own homes. And so that we need to make sure that those kinds of alternatives are available across the whole country, not just in little pockets of excellence as they are currently. I think there's a part of our proposal around commissioning and procurement is for what we describe as a new deal for providers. And so I think we are not shying away from the fact that we're asking more of that group. We're asking for their collaboration around the planning of the future of social care support in Scotland, but we're also asking them for transparency. And indeed, we recommend that the care inspector ought to be given a financial oversight function. And that is not really, that's, you know, most care homes are ticking by and not making huge profits, but some, as far as we can tell, and it's often not easy to tell, but independent reviews south of the border suggest that some are making margins of 15 to 17%. And if that's the case, I think the public has a right to know.
But would you then move on to capping that?
I think that we would need to look at the legal consequences of that, and I'm not a lawyer, and so, but I would have, I think, some questions about whether that was within the law to do. However, I think what is entirely feasible is to set out what are our expectations as a response to receiving public monies. So if you're going to take public money, here's what we expect in return. And those, I think, are about that transparency. They're about the ethical issues around fair pay and fair work. They're about, I think, engaging in improvement activities. And so I think there's just a new ask on the care home sector. And my sense is that the vast majority of care home providers will be able to comply with that, and indeed will want to comply with that. Will want the greater transparency, public confidence, the quality improvement, perception that people they're interested in continuous improvement. They want to pay their staff a decent wage, and so for the vast majority, I think there's nothing threatening in all of that. It's just about restoring public confidence in the care home sector.
And critically, looking right across the social care sector, one of the big revelations of COVID-19 for me was the lack of data. That sometimes we didn't even know where our beds were, or, you know, our care home beds were. How does the report or the review recommend that we tackle that? Because you talk about transparency, we need the information first, accurate information, yeah?
Yeah, so there's some good things to build on there. The Chief Nursing Officer and our team have instituted in every care home in the country what they call a daily huddle. And so that's the care home staff coming together to say, okay, how many beds do we have? How many empty beds do we have? How many people are we worried about today, etc. So we've now got much more real-time data on what's happening in the care home. That needs to be a feature not just of managing the pandemic, but as managing the sector moving forward.
Right across the board. Another point that's been made about the report is that while it was great that housing was referred to, that some people felt perhaps it wasn't given enough prominence for keeping people at home. The new housing, the kind of housing we're going to need in Scotland that's technology enabled. Because increasingly digital technology is being used to keep people well at home. And in fact, the absence of it might even be a human rights issue, yeah?
Yeah.
Do you think that we need to do more to bolt housing into thinking about health and social care in Scotland as well?
Yeah, again, in the section of the report where we describe some of the emerging models of care, Penny, those ideas around extra care housing, we applaud and recommend that those ought to be taken forward. And likewise with technology, and the technology can be retrofitted to people's existing housing. Doesn't need to await new housing capacity to be created. So technology has a role to play. Alternatives to residential home in people's in supported or extra care housing, again, important. But I wouldn't want us to think that all of the solutions for the future are about bricks and mortar or information technology. A lot of what's required is just about relationships. It's about behaviours and attitudes and empathy and relationships.
Okay, and until very recently, that's been based on who holds the power and the money. We've come to the money questions finally, and there were lots of them. It's funny money that's needed to bring up the parity of esteem, isn't it, between a National Care Service and the National Health Service? I mean, the numbers are eye-watering.
Well, it's not an insignificant sum of money that we recommend in the report might be required. And I would make a couple of points, Penny, about that. Firstly, it's really important to see this as an investment. It's an investment in change. We are not suggesting just pumping more public money into a system that's not delivering. We're saying in order to get a system that does deliver, you need to invest in these places. Secondly, I think it truly is a good investment of public money in the social economy. And we refer in the report to some findings that back that up. A study in Northern Ireland of the Independent Living Fund that saw an 11-to-1 return. So for every pound that was spent on the Independent Living Fund, £11 of social benefit secured. There are not many investments of public money that get you that kind of return. Likewise, a study that was done by the Women's Budget Group, where they compared an investment in social care to an investment in construction, and social care did twice as well. So it's not as if we're not looking for a handout, Penny. We're looking for an investment, and we think it's a good investment. We also think it's a fair investment. So we know, for example, that 83% of the healthcare workforce are women. So if we made some of the investments in the workforce that we're suggesting in the report, not only would that be fair to the entire social care workforce, it would help us close some of the gender inequities that currently exist in our system and ought not to.
It's 10 years since the Christie Commission report published on how do we need to address our public services. And broadly, it's the same spirit as your report. But there are many things that haven't been achieved that the Christie Commission recommended. In terms of implementation of this report, if it's accepted, because it's only recommendations, would you hope to see it all happen, or can it be cherry-picked?
So firstly, we do recognise some of the resonance with the Christie Commission report in our report. The focus on prevention is an obvious place where the two reports intersect. So I think it's really important, as I said to you earlier in our conversation, Penny, that we keep the report intact it's structured in the way it's structured for a reason. You know, if all we do is create a national care service and we don't close the implementation gap, then we'll just have, you know, we'll reinvent variation in a different way and in a different place. If we don't do those things, excuse me, together, and really shift our narrative about social care and what it's for, we'll invest in the wrong things, and we won't take the rights-based approach I think that everybody believes that we ought to take. So from that point of view, I think it's really important that people look at the report in the round. Then, Penny, I think we hope that the report is the start of something and not the end of anything. And I have sufficient humility to realise that we probably haven't covered everything that we could have covered off, and we probably haven't provided the perfect set of recommendations. And if the report gets people talking about, well, that doesn't look ideal. On further reflection, that's maybe not the best way to solve that. Here's some alternatives. That's great with me. If there are better options available than the ones we've been able to put on the table, you know, bring them on as far as I'm concerned. But the caution I would offer is really about create a national care service and close the implementation gap and shift our thinking. Do all three of those things. Don't cherry pick in terms of the broad themes. If there are 50 odd recommendations in there, if there's one that you could make work better, have at it. Please do.
And we're going to need a government that's going to be prepared to front load the investment in this, aren't we? You know.
Yeah, I think both. I think the first prioritising those recommendations, I think, would be a sensible. If I was still in my old job as the Director General of Health and Social Care, that's what I would be doing right now. I would be going through those recommendations and saying, okay, this can be done immediately. This is going to take a little bit of time. We need to have some thinking about this. This is going to need some legislation, and I'm sure that work is underway at the moment. Of course, we have between now and May manifestos to be written and the preparations for an election. That will give us also some clues about where the political prioritisation will lie. And Penny, I think it probably will take the full term of a parliament to implement all of this. And at the same time, there are some things in here that we could get on and do right away.
Okay. Which ones? What would be your top picks? You've got 53 recommendations in this report, Derek Feeley. What would you go for first if you had the magic wand?
I think we should start where we start on the report, which is with the new narrative. And because that will inform our investment decisions.
Okay, and who has to lead that then?
One of the things that we talk about in the report is the potential of something that we call a social covenant. Mm-hmm. So it's a meeting of minds, because there is a lot in the report about changing structures and processes, but we'll not do that effectively unless we first change hearts and minds. And so if it was me, I would be starting with hearts and minds. Let's get the group of people together that we are going to need. Let's start to practice what's preached in the report, for example, about people with lived experience and unpaid carers as equal partners, and get them involved in that social covenant that will shape the way in which we think about social care in the future, and then the actions and the investments that we prioritise. I think that it's been encouraging to me to see the government begin to respond to some of the needs of unpaid carers, but I think for me, that would be an early priority. They are kind of cornerstone of the whole system. the feedback that we got about the Independent Living Fund was just so positive that that would be another place I would look to see early on about how and whether we could get that reopened. So there's a whole host of things that will be decisions for others to take, Penny.
And finally, Derek Feeley, what are the risks if this becomes another report that gathers dust on a ministerial shelf? What are the risks of not doing any of this?
Well, if we do nothing, if we always do what we've always done, we'll always get what we always got. And firstly, Penny, I don't think that's a significant risk. My sense is that that people understand now that the risks of doing nothing outweigh the risks of doing something, and that we'll see a real focus on social care in the political landscape over the coming months and years. That will be much welcomed. We'll see a lot of attention. And again, back to what I said earlier, I'm not pretending that this is any kind of formula for success. I hope it's the beginning of a conversation about what we should do differently in Scotland. But my sense is that there's enough will in the country to do things differently that we'll see at least some of the changes in this report recommended.
Thank you so much, Derek Feeley, and very best of luck for it.
Thank you, Penny. Good to speak to you as always.